Which is more important for weight loss, calories or hormones? The truth is that both are important. But today, I'm going to focus more on hormones because they are some of the most potent biological compounds, and they can and do have a significant impact on your weight. If you've been having trouble losing weight, you should pay close attention because it's likely that your hormones are at least partially to blame. But to return to the question of calories versus hormones for a moment, one useful way to think about it is as follows. Generally speaking, your hormones become more significant the more overweight you are. This is especially true if you are trying to lose more than 25 pounds. If you are closer to your ideal body weight by 10 to 15 pounds, then calories will become more significant to you. This is because obesity alone causes a significant disruption to your hormones, and it takes a lot of disruption to reach these higher levels of weight gain. So if you are someone who needs to lose more than 25 pounds, this information is for you. The good news is that patients who require or have low levels of these hormones and wish to reduce their body weight can choose among bioidentical hormone replacement solutions. As a quick disclaimer before we begin, you should be aware that hormones, the ones we'll be discussing in a moment, are extremely potent, and if you take them without a documented deficiency, you may do more harm than good. Having said that, these hormone replacement options can significantly help supplement your current weight loss therapies and help you lose weight quickly. Alright, so let's talk about the best hormones for weight loss starting right now. Testosterone is at the top of the list. As we proceed, I'll let you know whether the hormones we're discussing are more applicable to males or women, or if they are useful to both sexes. This is why testosterone is one of those hormones that is relevant and important to both men and women who are trying to lose weight. Of course, testosterone does much more than this, but this is likely the most significant benefit if you are trying to lose weight, because you can think of your lean muscle mass as the organ of both metabolism and longevity. Sarcopenia, a decline in lean muscle mass, should be avoided at all costs. As I mentioned earlier, obesity tends to cause a decline in testosterone. This is a perfect example of how the more weight you gain, the lower your testosterone levels will be, and the easier it will be for you to gain weight. Therefore, you should do everything in your power to protect the amount of muscle mass that you have. If you allow your testosterone level to remain low, that will hinder your body's ability to build lean muscle mass, and your metabolism will suffer as a result. This is a big problem for people who are already overweight, because obesity has a tendency to cause a decline in testosterone. You don't need to take bodybuilder levels of testosterone to notice improvements in your weight and health, but this relationship is well documented, which is why bodybuilders commonly use it to help grow muscle mass and why there are hundreds of TERT clinics worldwide. Small doses of bioidentical testosterone can help men lose weight and gain lean muscle mass. It can also boost their mood, libido, and energy levels. Although using testosterone is obvious, it can be a bit more difficult for women than for men. Almost invariably, obesity causes testosterone levels to be below normal. But for women, this isn't always the case. Weight gain can occasionally cause an increase in androgens and cause POS-like syndrome in women. So if you're an overweight woman considering testosterone use, make sure to check your levels first. When it comes to testing, you should look beyond the standard reference range that your lab company provides because it's very broad and doesn't account for low normal levels or suboptimal levels. Generally speaking, testosterone replacement therapy is a very safe and successful treatment if your testosterone levels fall between the bottom 25 of the given reference range. Progesterone, which is more pertinent to women than men, comes in at number 2 on the list. Progesterone is a sex hormone that works as an antagonist to the effects of estrogen. Women frequently have higher levels of estrogen activity than progesterone activity because progesterone begins to decline more quickly than estrogen around age 35. This means that even though both progesterone and estrogen gradually decline until menopause is reached, progesterone declines earlier and more quickly than estrogen. In addition to this, the process of aromatization increases the likelihood that you will produce more estrogen the more weight you carry. An enzyme called aromatase is found in your fat cells, and it converts androgens into estrogenic chemicals. This may not seem like a problem, but the more fat you have, the more active this enzyme will be, and the more estrogen you will produce. Until you understand the precise role that estrogen plays in your body, it is preferable to think of it as a hormone that aids in accumulation during the menstrual cycle. It also thickens the uterine wall. Progesterone use can help balance the ratio between estrogen and progesterone, which may help women lose weight. However, it also has the potential to increase the size of fat cells and breast tissue in normal amounts. This is not a problem, but if its effects are not countered by progesterone, it can lead to excess weight gain and other issues down the line. It accomplishes this by helping the body get rid of extra fluid and water retention, and by opposing the anabolic effects of estrogen. Although men shouldn't use progesterone, women over 35 who exhibit either the signs of low progesterone or the signs of high estrogen should definitely use it. Then it could be worthwhile to think about thyroid hormone as number 3 on the list. Since everyone has a thyroid, this information applies to both men and women. It's also probably my favorite hormone to discuss because I've made hundreds of videos on it alone. Like the other hormones we've covered, the more overweight you are, the more likely you are to have thyroid issues and gain even more weight. In fact, people are sometimes made fun of if they claim that their thyroid is the reason for their weight gain. However, the truth is that this is more accurate than you may think. And of all the hormones we've discussed so far, thyroid hormone is by far the most crucial for controlling your weight and metabolism. Although direct thyroid dysfunction typically only results in 10 to 15 pounds of weight gain, estimates indicate that your thyroid hormone regulates up to 40 to 60% of your basal metabolic rate. However, because it affects not only your metabolism directly but also other systems indirectly, it can cause numerous other problems and hormones that can cause excessive weight gain, such as progesterone and testosterone. If your thyroid is out of balance, it can cause a series of hormone imbalances that can result in much more than just gaining 10 to 15 pounds. The good news is that you can correct the issue. There are several different types of thyroid hormones, but the two most significant and crucial for controlling your metabolism are T3 and T2. Both of these thyroid hormones are bioidentical, and only one of them needs a prescription, which is T3. T2 can be bought as an over-the-counter supplement. There is growing data that suggests T2 could be utilized as a standalone weight loss pill. You should be informed that T2 is still in the experimental stage if you wish to utilize it for weight loss, because this research is still developing. If you would like more information, I have a video that goes into much greater detail about this. It is important to evaluate not only your TS levels, but also your free T3 and free T4 levels if you want to determine whether your thyroid is malfunctioning. Regretfully, your doctor does not commonly request these tests. Therefore, you might need to ask for them specifically. DHEA comes up at number 4 on the list, and both men and women can benefit from it. As a precursor hormone and a hormone with direct androgenic action, DHEA is the most easily obtained and least likely to cause serious issues if taken. You can think of it as a very weak form of testosterone, which your body uses as a building block to create more potent hormones like estrogen and testosterone. DHEA, which stands for dihydroepiandrosterone, is a hormone secreted by your adrenal glands. You can't really force your body to produce more of what you want, so if you take it, you're really just crossing your fingers and hoping for the best, because despite the fact that you can't force your body to produce what you want, it's relatively weak and not very likely to cause problems in general. Because of this, people tend to use it to try and increase or indirectly impact these more powerful hormones. There are advantages and disadvantages to this. There is undoubtedly some benefit to using DHEA directly, most likely through its effect on blood sugar and insulin resistance, like T2 thyroid hormone. VIAD is available as an over-the-counter supplement that does not require a prescription for estrogen, testosterone, and some forms of progesterone. But no matter what you choose to take or do, there is at least one double-blind, placebo-controlled trial that demonstrated that taking DTA for 6 months resulted in a decrease in visceral abdominal fat and subcutaneous fat. If you like the idea of supplementing these therapies, you might find this video interesting as it covers some of the best non-hormone weight loss supplements available. Keep in mind that while hormones can help you feel better and lose weight, they should never be used alone for the best results. Instead, they should always be used in conjunction with diet, exercise, and intermittent fasting.